Hello. So, chapter 16, therapy, right? So, you kind of got two main sections to this chapter. First, you got psychotherapy. Psychotherapy is going to be any type of psychological approach to therapy, right? So, any kind of, I guess it'd be safe to say, any kind of talk therapy. Although you got behavior therapy in this too, which isn't always a lot of talking, although I suppose they do that too. So psychotherapy is any psychological approach to therapy. It's a catch-all term that includes all psychotherapies. But then you got different psychotherapies, different types of psychotherapies that focus on, different theoretical approaches to trying to help people from a psychological point of view. Now, in this chapter, they kind of separate those different psychotherapies a lot, and they talk about what psychodynamic therapy is like, what cognitive therapy is like. But in actual practice, you don't usually have, it happens. You can have psychotherapists who are exclusive to one, and they exclusively use one type of psychotherapy. But most psychotherapists, just a general term for therapists, right? Most psychotherapists use a variety of approaches. So they've been trained in a number of different techniques, and they won't use exclusively one technique all the time. So in reality, often they'll use a lot of techniques from a lot of different approaches, whatever they believe can help this particular client with this particular problem. So even though they talk about these different psychotherapies as if they're separate, and and aren't used together. In reality, they are used together a lot of times. And then, of course, the second part of the chapter talks about biomedical therapy, which, of course, the most widely used biomedical therapy, of course, is drug therapy. Right? We like our drugs in the Western world, and in America, we like to pop those pills. Right? That's what people want most of the time, actually. You need something more than just a pill, right? A lot of times. Getting an antidepressant medication from your family doctor because you're in the blues and you're depressed, and you get them to write you an antidepressant, that can help with, the biological component of it. But there's still other factors, psychological factors that would be useful to address and helpful, especially in preventing recurrences of something like major depression. So ideally, you want to use all of these in tandem with each other. In practice, I'm afraid, maybe most people just get the medicine, right? But ideally, maybe the medicine, but also psychotherapy. So anyway, they talk about that. They talk about a little bit, about the history of psychotherapy, although not a lot. They do mention, a few very important people in the development of the treatment of mental disorders or psychological disorders. And I think I mentioned that really a little bit at the beginning of chapter, 15 too. So you had individuals like Philippe Pinel in France, who, you had these large insane asylums, which were just warehouses for people to be locked up. And you just believed there's nothing that could be done for these people. They were treated like animals, basically, and abused. Then Philippe Pinel, is given the most credit for basically humanizing the treatment of these people, treating them like human beings, treating them like someone who has a disease, and a disease that can be treated, that they can get better from, right? Which is just a completely different view, right? To just, there's just something wrong with these people. There's nothing you can do about it. Let's just lock them up and forget about them, right? Versus, no, these are people. These are real people with real feelings, real emotions, real human beings that are suffering that we can help. And so Philippe Pinel really increased the humanizing treatment of these individuals. Don't keep them chained up. Have large grounds around the asylums where you can get fresh air and exercise. Feed them well. teach them jobs, like occupational therapy, we might call it nowadays. Teach them jobs they can do when they're out of here, treat them well, and a lot of them got better, right? It was just that, basically. And even though you're treating these people better, there is still no real treatment for them, right? But just treating them better led to thousands just recovering, right? But there was still no real psychotherapy for these individuals, and of course they mentioned Dorothea Dix as well, who in America called a lot of attention to the way that at the time you might refer to them as insane people, how they were treated, which once again was just terrible, right? Just living in their own filth, locked up. And so Dorothea Dix created a movement to once again kind of follow the European approach, where you'd build larger state insane asylums with grounds, fresh air, exercise, treating them more humanely, that sort of stuff. And it's doubly impressive to me that Dix was able to create this movement to do this across the United States at a time when women didn't even have the right to vote, But unfortunately, like all reform movements, I guess really throughout all of human history, right? You get the reform, you build these new insane asylums to house a certain number of people, and after a time the reform wears off and you start putting more and more people in these institutions, and once again there's overpopulation of the institutions, and unfortunately that's the pattern throughout human history, right? So anyway, but that was the start of treating people more appropriately, actually thinking of people who had mental disorders as being people suffering bona fide disorders. And don't forget, that's what I said in the last chapter, in chapter 15. These people cannot control it, right? It's beyond their control. You just can't ask them to toughen up. Right? It's something that's beyond their control, and there is genuine suffering there. And I know that's hard for us who don't experience that to understand. But these people deserve sympathy. They deserve empathy. But anyway, so I guess that's just kind of an intro video of chapter 16. And hopefully you're getting started and you're studying this stuff. All right?